Hello, thank you for joining me on Power to Heal. I am Dr. Jeffrey Brown. Did you know that the death rate from a hip fracture is higher than that of breast cancer, and yet it doesn't get nearly the publicity that it should get? All right, statistics show that up to 24% of people die within the first year of having a hip fracture, where the chances of a woman dying from breast cancer in the first year is about 1 in 40 or 2.5%. It's important that people are aware of how serious osteoporosis can be and the steps that can be taken to reduce their risk. All right, osteoporosis is a progressive metabolic bone disease characterized by decreased bone strength, increased bone fragility, and increased risk of fracture from minimal trauma. So what's minimal trauma? Minimal trauma is one that occurs after a fall from a standing height or less, or a minor force that would not normally cause a fracture in a healthy young person. In the Dubo osteoporosis epidemiology study, it showed that in the first 5 years of a fracture, approximately 26% of women and 30% of men actually died. Now, the fracture itself is rarely what causes the death of people, but it's all the complications that arise from the fracture that leads to death. So osteoporosis is diagnosed by a DEXA scan. A DEXA scan measures the bone density, which is a measure of how strong and fracture resistant that bones are. A DEXA scan is recommended for women over the age of 65, and or women who are over the ages of 50 who are at high risk. So what increases the risk of osteoporosis? There are 8 things that we will discuss that increases your risk of developing osteoporosis. Aging, small body frame, sedentary lifestyle, excessive alcohol consumption, smoking, low hormone levels, low vitamin D, and medications. Number 1, aging. We can't stop Father Time, but we can make healthy choices during a lifetime which will decrease our risk. You can choose how you age. All right, number 2, small body frame. Petite and thin women have a greater chance of developing osteoporosis. Small, thin men also are increased risk for developing osteoporosis. It is imperative that small body frame people do resistant training, such as weightlifting, resistant bands, free weights, or even use your own body weight to strengthen their muscles, tendons, and bones. This type of exercise puts stress on the bones, which makes them stronger. The third thing that increases your risk is having a sedentary lifestyle. As I just spoke about, if you don't stress the muscles or the bones, they are going to get weaker. Everything in nature adapts to the stress placed upon it. So if you don't challenge the body, your body's going to wither away. So in addition to the resistant exercises that I spoke about, I recommend climbing stairs, doing squats, brisk walking, dancing. These are also good weight-bearing exercises. A minimum of 3 days a week we recommend to improve the bone strength and muscle strength of our body. You can do 3 days a week. All right. The fourth thing that increases your risk is drinking excessive amounts of alcohol. It can have a negative impact on bone density and increase the risk of developing a fracture. Alcohol consumption can interfere with bone remodeling, which is a process where bones actually break down and then rebuild. Alcohol reduces the body's ability to create new bone and repair existing bone. Alcohol can increase bone resorption, which is when osteoclasts break down bone to release calcium into the bloodstream. Osteoclasts are cells that break down old and damaged cells so that new bones can form. Alcohol can cause overactivity of these cells, which can lead to abnormal loss of calcium in the bones. All right, so regular alcohol consumption is toxic to the body. Save the drinking for holidays and special occasions. Now, the fifth thing that increases your risk of osteoporosis is smoking. It is a major risk factor for osteoporosis and increasing the risk for fractures. Smoking affects the body's ability to absorb calcium. All right, nicotine slows down the production of bone-forming cells called osteoblasts. These are crucial to healing. Smoking can cause more rapid bone loss as people age. Smoking reduces the blood supply to the bones, which means that there's less nutrients received for growth and repair. Now, I know smoking is difficult to quit, but anything worthwhile in life does not come easy. The sixth thing that increases your risk for osteoporosis is having low hormone levels. As we age, our hormones naturally decline, except for cortisol. That's our stress hormone. That's the only one that goes up as we age. The rest of the hormones go down. Now, estrogen is a key regulator of bone metabolism and density. It promotes the activity of osteoblasts, right, bone building, which are the cells that help to make bones, that I just said. Decreases in estrogen levels can lead to osteoporosis. Now, multiple studies show that testosterone treatment increases bone mineral density. There was a study published in an international, multidisciplinary, peer-reviewed scientific journal, that's a lot, which showed that testosterone enhanced the effectiveness of estrogen when they combined together. All right, they looked at women who received the estradiol skin implants underneath the skin alone, and those who also received both testosterone and estradiol skin implants. And they used the DEXA scan to measure the bone density. Those women who had received both testosterone and estradiol, had significantly improved bone density levels compared to women who just had estradiol levels. Now, progesterone is another hormone that plays a key role in bone density and health. It works with estradiol to increase the formation of new bone cells. Progesterone can help prevent and treat osteoporosis in women. So having healthy estrogen, progesterone, and testosterone levels in women is a key strategy to prevent as well as treat osteoporosis. Now, the seventh thing that can lead to osteoporosis is having low vitamin D levels. So I recommend vitamin D levels in everybody, and also make sure it has vitamin K with it. You can't get enough vitamin D through food. Vitamin D helps your intestines absorb calcium from the food that you eat. Vitamin K activates proteins that help form bones. Vitamin K helps calcium bind to bones. Now, I don't recommend calcium supplementation because it can increase the risk of having a heart attack or stroke. Calcium supplements increase blood calcium levels, which can contribute to plaque buildup in your arteries, which increases your risk for having heart attack and stroke. All right, get your calcium through food. Dark green leafy vegetables like spinach and kale, collard greens or broccoli, through seeds like chia seeds, poppy seeds, sesame, celery. You get it from almonds, beans, and lentils. I just don't recommend taking calcium supplements like most of you have been told and even heard about. The last one I want to talk about that can increase your risk for osteoporosis is medications. All right, so I want to talk about 4 commonly prescribed medications that increases your risk of developing significant bone loss and that can lead to fractures. The first one are glucocorticoids. These are steroids like prednisone and Medrol dose pack. They are used to treat autoimmune disorders, inflammatory diseases, dermatological and respiratory diseases. All right, so what happens? It decreases bone building cell precursors called osteoblasts that we spoke about before. It stimulates osteoclasts. Those are the cells that break bone down. It induces bone cell death and decreases calcium reabsorption. So if you suffer from autoimmune disorders or have inflammatory diseases or dermatological issues or any ones I just mentioned, watch my 2 videos, the first 2 videos on endometriosis. And I talk about ways to modulate the immune system as well as improve your overall health. The second medication we're talking about are protein pump inhibitors, PPIs, omeprazole, also known as Prilosec, Nexium, or Prevacid, very commonly prescribed medications. They suppress acid secretion, which decreases the absorption of calcium in your intestines. All right, you don't need to use it over a year. A lot of short-term studies, show that it doesn't seem to affect bone health under a year, but after a year, multiple studies show that it increases your risk for having vertebral and hip fractures. So if you suffer from gastrointestinal reflux, GERD, heartburn, other ways of describing it, do the following. We're going to talk about a few things here. First, eat your main meal, at lunchtime, and eat a smaller meal at dinner time. Don't overeat. Eat small meals throughout the day. Don't eat right before bedtime. Allow at least 2 hours, for your food to digest before you go to bed. The next thing, focus on eating whole foods and avoid the common triggers: coffee, caffeine, citrus fruits, tomatoes, spicy foods, garlic, onions, fatty foods, peppermint, and alcohol, like we spoke about before. You can also try taking melatonin, 3 milligrams at bedtime. That's right, I said melatonin, the one that helps you sleep, but it's primarily produced by the pineal gland in the brain, but it's also made here in the gut. All right, but melatonin protects the gut against GERD by increasing blood and anti-inflammatory molecules in the esophagus, and which prevents injury. So I know you think that GERD is caused by too much acid, but it's actually the opposite. Oftentimes it's too little acid that is produced. Our stomach secretes acid to break down protein so that we can get the amino acids, but it also is there to help kill off harmful bacteria, viruses, fungi, and parasites. So when the stomach acid hits a certain pH, the food is broken down and it signals the small intestines to open up and let the food to go in. If the stomach acid doesn't reach that pH, the food's going to stay there in the stomach and it can become rancid. And then it can bubble up and hits the esophagus and they can burn it. And if it goes too long, it can actually burn that valve in between the stomach and the esophagus, and it becomes damaged. And then you can start letting acid in, when you bend over, when you lay down, and obviously that is not a good thing. So those protein pump inhibitors that we spoke about should be used for short-term relief, because long-term relief is going to be problematic. It can lead to harmful organisms getting into our body. It can prevent our foods from breaking down, specifically getting from protein to the amino acids, which is very important for building our body. It's the building blocks of our body are the amino acids. So we want to make sure that we can break down our protein. Now the stomach acid is made from the amino acids that come from the protein we're trying to break down. So very important. So in addition to avoiding those food triggers that we talked about before and taking melatonin at night, try taking a digestive enzyme, all right, that has hydrochloric acid with your meals. This can increase the acidity and may also help to reduce or remedy the situation. All right, the third medication we're going to talk about are the selective serotonin receptor inhibitors, also known as SSRIs. Lexapro, Prozac, Zoloft, these are examples of those. I know most of you have heard of these. All right, commonly used for depression, or anxiety, which many people suffer from. Now, serotonin is a neurotransmitter, and to make it, you have to have sufficient amount of amino acids in the body, which is why it's imperative that you have sufficient stomach acid so that you can break down the protein to create these amino acids. Tryptophan is the main amino acid involved in producing serotonin. Iron, magnesium, vitamin B6, folic acid, vitamin C, zinc, calcium. These nutrients are all necessary cofactors to convert tryptophan into serotonin. So it's imperative that we have a healthy gut to have a healthy brain. All right, people who suffer from anxiety or depression, they don't have a Prozac or Zoloft deficiency. They most likely have deficiencies in their nutrient status due to deficiency of stomach acid. Or you may have absorption issues or imbalances in the gut microbiome that are causing these problems. Having a comprehensive stool analysis or a GI map test, as well as a comprehensive nutrient panel done, is imperative for those who are struggling with anxiety or depression. These are great tests to do. Women with low levels of hormone, they also struggle with depression and anxiety, and that's something we need to look at. Progesterone is a natural anti-anxiety hormone. Estrogen as well as testosterone deficiency will cause depression, or irritability. So it's important to work with a functional medicine physician who is trained to look at the whole picture and can get to the root of the problem. Now, the fourth and final medication I want to talk about is the medroxyprogesterone, which is also known as progestin, or people know the Depo-Provera shot, commonly used for birth control and is very effective against getting pregnant, right? That's why people use it. So if you're only using it for contraception, I would encourage you to use barrier methods for long-term use, as your risk for osteoporosis greatly goes up, as well as breast cancer if you continue to use these progestins. Now, if you're using progestins because you are having painful periods, acne, or bad PMS, and you're just trying to mask a problem with the progesterones, I encourage you to watch my endometriosis series as I address a holistic approach to help you balance your hormones. So these are 4 commonly prescribed medications, and they are overprescribed. And there are natural, holistic approaches to address these common medical conditions that these medications are used for. So I encourage you to find a functional medicine physician who is experienced with treating these issues. Now, I hope you enjoyed this video. Please share it with your loved ones. Please subscribe to this channel if you want to continue to get our information. And remember, you do have the power to heal. Thank you.